In this video, I want to discuss the difference between Hashimoto's and hypothyroidism. Now, so many people suffer from either of these conditions, yet they may not understand what is the difference between these two. A lot of times they get used interchangeably and they don't understand the relationship between these two. What is Hashimoto's? What is hypothyroidism? And are they related? Now, hypothyroidism, as the term suggests, is talking about hypo or low thyroid, which is thyroid hormone. So essentially, it's talking about a physiological state when you have low thyroid hormone. Now, this can be low where it's completely out of the range, or it can certainly be suboptimal as well, where it's starting to go down and it's gone down to the lower end of the range with the TSH going up, TSH being the thyroid stimulating hormone, and it hasn't fully gotten out of the range, but we're starting to see the initial workings of hypothyroidism. So low thyroid hormone, we're talking about basically a lab finding along with certain symptoms. And those symptoms can be weight gain, hair loss, low energy, poor mood, depression, irregular cycles, constipation, various gut related imbalances too. So, temperature imbalances as well. So, cold, often feeling cold and not being able to regulate your temperature well. So, these are the symptoms associated with hypothyroidism. So, when we have symptoms and we have abnormal lab values, most of the time, that combination is hypothyroidism. Now, when we talk about Hashimoto's, what we're really talking about is an autoimmune condition that impacts the thyroid gland and various other systems around the body. And when I say an autoimmune condition, I'm talking about the immune system unable to differentiate between a foreign antigen or a foreign invader and between self tissue, that's your own tissue. So, because of this confusion, because of the loss of your immune system being able to discern this, basically your immune system is going and attacking various systems of the body, various tissues, and that is an autoimmune condition. And depending on what system it attacks, what tissue it attacks, that's how we name the autoimmune condition. In this case, we're talking about the thyroid gland, so we're talking about Hashimoto's. So, really, when we're referring to hypothyroidism, we're talking about that innate issue within the thyroid gland. When we're talking about Hashimoto's, we are talking about the innate problem within the immune system. So that's the difference between the two. Now, what is the connection between these two? Because they're often used interchangeably. Well, the difference, or rather the similarity between the two, the connection here, is that Hashimoto's often goes and causes hypothyroidism in time. Because what Hashimoto's is doing is that the immune system is causing progressive destruction of the thyroid gland through various mechanisms. And that has caused, over time, that can cause abnormal thyroid levels and cause symptoms of hypothyroidism. So that's where the two connect. But I often hear patients using the terms interchangeably, where someone will tell them that because they had hypothyroid symptoms or abnormal thyroid lab values, that they're told that they have Hashimoto's, where that's not the case at all. Hashimoto's has a very clear-cut diagnosis. If you have positive antibodies to the thyroid gland present in your blood work, most commonly thyroid peroxidase or TPO, and secondarily as well, antithyroglobulin antibodies. If you have some of these antibodies present, then you have the diagnosis of Hashimoto's. And if you don't, then you really don't have Hashimoto's. Whereas some patients will just have low thyroid levels and they are put on thyroid medication and they might be told that they have Hashimoto's. And that's not the case. So I think it's very important that we are clear about the diagnosis and clear about the terminology, because it's important to be accurate. On the flip side, you have a lot of patients that might have might have Hashimoto's when we test them. And we find the Hashimoto's, but they were never really told about the Hashimoto's from their physician. Because again, it's just all considered one and the same. So what's the difference? Whereas again, I think for me, it's very important for me to know whether you have Hashimoto's or not, because that impacts so many other symptoms and so many other systems of the body. So Knowing you have Hashimoto's or not is very important, and also being able to differentiate what that means between Hashimoto's and hypothyroidism, that's also very key. And lastly, I'll leave you with this. There's a thought in more conventional or mainstream medicine that Hashimoto's only impacts the thyroid gland. And because of that, I think a lot of physicians get stuck with this, that if they find Hashimoto's, or if a patient has Hashimoto's and comes to them, the only thing that they're thinking is, when do they need to be started on thyroid hormone replacement in their future? That's the only question worth answering to a lot of physicians, because the logic goes, if you have Hashimoto's, it will inevitably cause destruction of the thyroid gland that will ultimately lead you to needing thyroid hormone replacement without a doubt. We just don't know when that is. And also, beyond that, there's nothing else we can do for the Hashimoto's. And that is a very, very incorrect way of thinking. Hashimoto's actually has, above and beyond just the thyroid, it impacts various other systems around the body. It impacts the brain. That doesn't get discussed much. It impacts the gut, and it causes gut imbalances. It impacts female hormones. It impacts the liver. It impacts, obviously, immune health. There are so many aspects to overall health in the body that Hashimoto's impacts. And if you just get tunneled into this thinking that the only thing that's important with Hashimoto's is the discussion around thyroid hormone replacement, then you're going to be missing out on a whole bunch of symptoms and a whole bunch of other issues going on around the body. Now, I've spoken at length about Hashimoto's in other videos, talking about what it is, what are the mechanisms that impact, that it can lead to impact in patients' health. So that is present in other videos. But here I just wanted to address this common misunderstanding between hypothyroidism and Hashimoto's.